Welcome everyone to today's webinar, How to Transform the Patient Experience in the Age of Consumerism and COVID-19, a technology-focused conversation. I'm Morgan Hafner with Becker's Hospital Review. We will begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box that you see on your screen. We're looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I'm pleased to introduce our presenters for today's webinar. Peter Yates is the Senior Director of Cerner's Healthy CRM Business Unit. In that role, he manages Cerner Salesforce partnership and oversees the data and product integration between Cerner and Salesforce platforms. We also have Joshua Newman, who is the Senior Vice President of Healthcare and Life Sciences at Salesforce. Prior to Salesforce, he was an Assistant Professor of Medicine at UCLA and a practicing family physician. In prior roles at Salesforce, he served as Chief Medical Officer and General Manager of Healthcare and Life Sciences, and was responsible for product management, product strategy, marketing, and sales enablement for the global Salesforce healthcare business. At this time, I'm pleased to turn the floor over to Peter to begin today's presentation.
All right. Hey, thank you very much, and thank you to everyone out there for joining us. We have an agenda in 4 acts here with Dr. Newman and I taking turns talking through some of these topics. So we'll start with talking about how a clinically informed CRM can help provide a connected healthcare experience for consumers. We'll transition to how that can be used with automated messaging to encourage appointment and procedure rescheduling to recover lost revenue from COVID-19. And then we'll transition to how the same set of technology and data can be used to engage individuals around their gaps in care. And then finally, we will wrap up with how personalized communications can help drive consumers to enroll in the patient portal and educate individuals about their virtual care options. So I will start us off with the first topic here, really getting into some definitions around what is clinically informed CRM and how can that be used to provide a connected healthcare experience. And so in our opinion, that really starts with the profile. So we've got a great partner in Salesforce that has a world-leading CRM, but without a profile, you don't really know your customers or your patients. So really, we focused a lot on building out that clinically informed profile. We think that really has 3 elements to it. It needs to be comprehensive, it needs to be longitudinal, and it needs to be synthesized. So in terms of comprehensive, it needs to span sources. So you see the stat on the page here. Over our lifetimes, on average in the U.S., we have 18.7 physicians, and Medicare benefit. We have more and more of those towards the end of our lives. There was a study in 2007 that said that the average Medicare beneficiary, over the course of a year, sees 2 primary care providers and 5 specialists across 4 distinct practices. So our records, our healthcare profile is scattered all over the place. That's not even mentioning the payer and eligibility and claims data that exists about us as well. So a big part of this is pulling that all together into a single longitudinal record. The second part of comprehensive is around spanning types. So, we talk a lot at Cerner, coming at it from the EMR angle around PAMP, right? Problems, allergies, medications, procedures, and immunizations. And again, layering in insurance information, lab results that may come from elsewhere, your appointment history, and then calculating things on top of that, like gaps in care, which we'll talk about later, as well as your care team. So who are your attributed physicians, your preferred providers? So that's the comprehensive piece. We also talk a lot about longitudinal. So really, they're spanning time. So, healthcare, you have things that happen in the ICU where every second counts, and you've got data at the the second level of specificity to more general E&M type visits, all the way to, episodic care where you may have an orthopedic procedure that lasts months, or, all the way up to pregnancy that lasts typically 9 months, as well as, chronic conditions that, it's in the name, they're here to stay most of the time. So thinking about being able to capture within that profile enough history to where you can see changes and trends over time, both to identify when someone's trending poorly, but also looking at, are the interventions we're taking being effective? And then the final piece there is around synthesized. So how do we convert the clinical data into something that's useful within CRM? So, trust me, at Cerner, we can put more ICD and CPT codes into Salesforce than you can imagine, but most of the time that's not what you want. So really the goal is to synthesize and convert that data into something that's useful within a CRM context. So think about, your contact center agent. They don't have the educational background or the training of a clinician or a nurse typically, but how can we use this data in the right format and the power of CRM like Salesforce to prompt that scheduler and help script them through talking someone through the importance and value of getting a colonoscopy, or similarly for marketing and outreach, right? You don't want your marketers in there defining what is a controlled or an uncontrolled diabetic, looking at hemoglobin A1C values. I don't think the marketing people want to own defining that, and I don't think the clinicians want marketing defining that. So it's really, how can we use this synthesized data and have higher order insights about people that make it easier to do these CRM activities? And then, finally around synthesized, we want to be careful not to oversimplify. Having this whole person view and that broader context does matter. So we'll talk a little bit in a minute about the COVID cancellation and rescheduling as an example where that whole context comes together. And so that's the clinically informed profile as part of CRM. Now we'll talk a little bit about what is the connected healthcare experience. So you see on the screen here, this is not a connected healthcare experience, but it's the reality for most of us, right? Healthcare is complex and our organizational structures tend to reflect that. So we have multiple marketing groups, multiple contact centers. We have sort of the front office rev cycle, the back office rev cycle, managing provider networks through another set of people and technologies. And your patients may also be members of your ACO or your provider-sponsored health plan. They may be donors or volunteers at your organization. So really our goal with CRM is to try to pull all of this together. I think despite all of the people in these little bubbles on the screen doing their best, a lot of times patients in healthcare feel frustrated, feel like they're bounced around, not listened to, and ignored. And another part that you don't see here is really the complexity of adding communication channels to the mix. So we've, at Cerner, sort of tried to count them all up. We think there are 21 different modalities or communication channels. You have the oldies but goodies are at the face-to-face, the phone, and the fax machine. We're seeing more and more digital adoption. Right? We all have websites. We all have portals thanks to Meaningful Use. And most of us have mobile apps, and then we're adding SMS and texting, chatbots, social media. So that's all great, right? We're able to better reach our customers and our patients where they want to be met, but it's a whole new set of interactions to harmonize, and that's one of the really exciting parts about working with Salesforce on CRM. And so what is the connected healthcare experience? It's when for the patient all of this feels harmonized. So they feel like, hey, my health system knows me, right? They have the profile. I don't have to tell them the same 5 things every person I talk to even though I just gave them that information. They're available when I need them and how I need them. So again, talking about channels, right? I can, in a lot of other industries and retail, right, I can go to the store, I can go online, I can go online and then they put the thing in the back of my car at the store. So this omni-channel experience that's coordinated across the way I interact is the new expectation. And then, you know, third, they check in on me, right? I need to give my permission, but now you're starting to add outbound from your organization out to the patients. You know, everything from, hey, it's your birthday, time for your physical, to outreaching around gaps in care or other clinical things, right? There's sort of that help me and nudge me to manage my care. And then finally, there's coordination, right? So across all of these bubbles here, can we use CRM to make that patient feel like, hey, this organization has it together. The left hand is talking to the right hand, and there's kind of a closed loop aspect to, regardless of which node I interact with, they all know what's going on. So that's the clinically informed profile, and then define the connected healthcare experience. And then we'll finish here with why is that important? So I mentioned a little bit, but your patients and members are experiencing this every day in most other aspects of their lives. So retail, you know, when we were all traveling and taking planes and hotels, right? There is that in other industries using CRM, the ability to pull this all together and really optimize it around that connected experience. That's what our patients are used to in other aspects of their lives. And they are, you see here, over half of them expecting omni-channel, so being able to interact with your organizations across multiple communication channels. And then 92% of them want better experiences. So, you know, you can count me among the 92%. Just had a baby 10 months ago, and so, you know, we've had a great experience with the clinicians. Just a miracle that's how people are made, and that the nurses and doctors do that every day as their jobs. It's just mind-blowing. But then you have all of this stuff around that, the scheduling, the EOBs, the bill pay, kind of the patient being the human glue to coordinate between the specialists. That kind of takes away from the miracle of life there. And you know, Dr. Newman will hit on that more when we walk through a patient journey a little later in the session. So that was the sort of opening definitional part of the talk. We'll jump here to the second topic, really more of a COVID example of how all of that comes together. So, you know, just first of all, you can't overstate the impact of COVID-19 in healthcare organizations. You know, I'm out talking to a lot of you all and a lot of healthcare organizations on a regular basis, and you know, I've seen the impact, and just, you know, many of you are have experienced it on the front line. So thank you for everything you do. You know, at Cerner and at Salesforce, we're doing everything we can to help you and your patients and your organizations recover, and I hope this is part of that. But we were sort of back in the Cerner bunker looking at the data, and we just saw the wave of cancellations come through through our EMR customers and our healthy intent customers in the middle of March. And you know, a couple anecdotes. They're just one client had over 100,000 cancellations in the 30 days from March to April, and just, you know, you think through the huge patient impact of that, the huge revenue impact, and then just operationally, how do I go interact with 100,000 different patients to explain to them, you know, I'm sorry, your appointment was canceled. Here's why. Here's what we need to do in the near term, and then here's how we'll contact you to reschedule it when we're able to do so. Right? It's a whole set of problems, not to mention all the other things around, you know, ICU beds and ventilators and the other crises going on within your organizations. And so to do this, we at Cerner worked with our analytics team to push a cancellation dashboard to all of our healthy intent clients. And so you see a little piece of that here, but really looking at not just the appointment cancellations, but again, bringing together that clinically informed profile. So, we're aggregating the appointment data across sources. So, many of you have multiple EMRs within the entire breadth of your systems, multiple registration or practice management systems, scheduling systems across your systems. So we were able to pull all that together regardless of the source EMR and create that comprehensive view of a single patient's future appointments and how they were impacted by COVID. And then we're able to break that down by location, by physician, by appointment and procedure type. You think about giving people a specific clear call to action, right? So if you had someone with an orthopedic procedure canceled, the way that they need to reschedule and re-engage with you and do all the pre-procedure checklist is different than someone who had a dermatology appointment canceled. So being able to understand from the data how to flex that call to action and the outbound campaign, it's something you can do with this clinically informed profile and Salesforce CRM. And then another thing we saw our clients do was shift to virtual, right? So we had a good idea in the data of which venues and appointment types could be effectively done virtually. And so, again, able to do campaigns to that subset of patients around, hey, unfortunately, your dermatology appointment was canceled, but did you know that we have virtual visits for certain parts of our certain types of appointments, and here's how you schedule and perform one of those. And some of our clients saw a 30x increase in virtual visits pre-COVID to during COVID, and that's, again, we'll hit on some of the virtual pieces. Dr. Newman will at the end, but just seeing 5 to 10 years of change happen within the course of months in terms of the adoption of virtual visits was incredible, and the ability to message to patients in a personalized way about that was key to making that happen. And then a third part here around the comprehensive piece is really thinking about the recovery. So how do you prioritize patients who comes in first during the early reopening? So many of you, especially in the operating rooms, were at 10, 20, 30% of the normal volume. How do you prioritize which patients need that the most? So you can't go do chart reviews on tens of thousands or hundreds of thousands of cancellations. So how can you use the data from that clinically informed profile to sort of pre-sort? We looked at things like the medically necessary time-sensitive score, and we had proxies for a lot of those inputs around the clinical need of the patient and the complexity and some of the COVID risks that we could do a pre-screen to get the list down to a manageable number to then do the outreach for rescheduling. And then finally, thinking about that connected healthcare experience. Looking at the data, we saw in that 30-day period, about 10 to 15% of patients had 2 or more canceled appointments. About 1% consistently across organizations had 4 or more cancellations. So, talk about an opportunity to help the patients who clearly need you, right? They've got multiple appointments scheduled with you. They're clearly an active patient. You could use that data to, for example, create a concierge scheduling program that you send them the message to engage with you, and you can have a team of people who, with a single phone call or interaction can reschedule 2, 3, 4 appointments all at once. Talk about taking a bad experience and turning it into something good. And so just to summarize here, again, sort of following this pattern of taking the data, creating that clinically informed profile for CRM, and then loading it into Salesforce to actually go and execute the outbound campaigns. We hadn't designed this to work specifically for that use case for COVID, but we found that within that profile we had the building blocks of data that were needed to go, really react quickly and help some of our clients re-engage with large numbers of cancellations. I'm hoping, I'll knock on wood here, we don't have to do that again, but should we have to, we will be ready to go. So with that, I'll hand it over to Dr. Newman to talk through another set of backlog that's building impacted by COVID-19 around gaps in care. And Dr. Newman, if you're speaking, I can't hear you.
Oh, thank you so much.
There we go.
Boy, I had such a great preamble and intro. So let me back up a second. So as Peter was describing the importance of CRM in healthcare, he also alluded to how the current pandemic has made that even more important and accelerated a lot of people's and organizations' transitions to enterprise CRM and its power. And so I'd like to talk today a little bit. The first sort of topic that I'll be addressing is CRM generally and how care gaps can be bridged. And what's really interesting about this is that what you'll notice is that you've seen some of this in your daily practice. You've seen the drop-off in elective procedures, and certainly vaccines and screenings fall into that category. And so there are a few different directions or ways to think about these kinds of numbers. The first is clearly vaccinations, screenings, and other elective procedures are way, way down. And we should think not only in terms of raising them up again for the revenue and the strength of the organizations, but also, of course, for people's health. There's also going to be a second wave of effects from these decreased screening and preventive measures. And it's important for us to sort of bake that into our CRM process so we can address it. But something else that's especially interesting to me is that while these numbers are down this year because of the pandemic, these numbers weren't doing so great even before the pandemic. It's interesting to note that pediatric vaccinations maybe 5 or 6 years ago in places like Santa Monica were down at the level of South Sudan. And even in this last year, the most recent report that I saw showed that some of the vaccines are also, pediatric vaccination rates are also down in some of those communities. And it's not because the communities don't have access. There's something else happening. And the same is true with cancer screenings. Some people say that about 90% of the 50,000 people that die from colon cancer could be saved. And so we haven't had such great results in terms of screening even before. And what's interesting is that the screenings are all the same. Certainly in across different communities, the people are the same. How come some folks get screened, some don't, based on race, ethnicity, social status, and other kinds of social determinants? And so what we see is that even in basic clinical services, and the things that are as objective as possible, the big differential in whether people are getting these services or not has to do much more with relationships, access, logistics, than it does with the clinical work, which is why CRM is so important in these contexts. And in order to solve these problems, a key concept is to think in terms of journeys. Now, for so long in healthcare, we focused on the clinical service that we provided, making sure that the medication or the vaccine or the procedure or the study was going to be done with great faithfulness and scientific rigor. But now it turns out that as those therapies and procedures have propagated through healthcare, the real sort of the place where people, the battlegrounds, are really around scheduling, identifying the need, helping people understand the need in themselves or their own healthcare journey, and then making sure they get the service they need and they have the appropriate follow-up afterwards. And so what we notice is in the process of building a CRM or implementing an enterprise CRM, many of our customers are starting to map out these journeys and including aspects of them that they never really thought of before, including the transportation, including parking, including any kind of information that people might need before or afterwards in order to assure the success of it. And so we encourage our customers to really adopt this methodology and to include every possible touch point. And there are a few reasons for that. One of the main reasons is it helps accomplish the goal. It helps get people in the door and get them the services they need. But the other thing is that a sensitivity to each of these touch points is also a sensitivity to all the ways in which an organization makes themselves visible and engages with a patient. And patients sort of accrue a long list of those kinds of interactions. And if they're positive, then they have a much more positive experience with the organization. Trust is greater, and everything from health outcomes to sort of business outcomes improve. And so two of the ways that organizations are doing this specifically to try and bridge these care gaps. One is to run automated campaigns that send out reminders to people. So this is the communication side. This is what can an organization use in their communications process to reach out to people, to appeal to them and communicate with them in ways that get them to reach their own healthcare goals. And what we find is in the sophisticated realm of sort of modern marketing tools and modern communications tools that are overlaid on top of the longitudinal electronic medical record and population health tools, these campaigns can segment individuals. They can reach out to people with personalized messages using the channels that people prefer, and they can alert people of all the kinds of things that they need to reach their goals. The other side of this, though, is even more important from my way of thinking. Automated messages have a certain kind of limitation in their power, but what we see is the most important tool that people can use in maintaining the health of their patients is people. So in the second half of the slide, what we see is the reminder that agents in a contact center who reach out and have outbound calls, or the ones that have inbound calls, have a great deal of power and ability to bridge gaps, build relationships, and build sort of an ally in patients to maintain and take care of their own health. But it's not really just relegated to communications and contact with people. It also really is around getting virtual care, and this is something else that Peter was alluding to. This statistic that you see here, about a 250% increase in the usage of virtual care, masks the really dramatic increase in people's utilization of portals and digital therapeutics. We see sort of in the news some of the news of some of the larger acquisitions and some of the large sort of venture raises, capital raises of some of these companies, but it really again masks the dramatic increase. And so if you were looking at the digital therapeutic utilization across a number of different systems, you would see a pretty consistent and low-level use for most of them. Very few hospitals, very few physicians were recommending it. Very few organizations had really invested in telemedicine or digital therapeutics for their patients. And people were sort of finding it on their own, or in most cases not. And what we saw around March was this tremendous spike. It was tremendous, the increase, and for obvious reasons. People need the care, they need the support, and what we find is that most healthcare systems are catching up with all of this. And so one of the ways of increasing this is to use these same kinds of CRM tools to reach out to people, and the communication, instead of being about following along a path on their journey, is really around using the tools that are available so they can take care of their health. The first of these is driving patient portal enrollment. For years, we've been working hard to get patients to take the kind of interest and involvement and engagement with their own health through portals that they do through so many other areas of their lives. And portal use as a conduit for patient information and activation becomes very important. And then the other side is the virtual care options. We're finding hospitals across the country invested and engaged and more open to alternatives than they ever have been. And really, I think what's driving this is the concern for the patient and the sense that these digital tools really work and they cause a great improvement in people's care. This next slide is pretty interesting to me because it really highlights where we've been focused for so long in healthcare and where we haven't been. Of these three sort of colored bubbles that you see here, target and acquisition, which is really around bringing people in, engaging and retaining them, that's making sure they stay connected, and delivering and managed care. Of these three boxes, or these three circles that you see, healthcare is really focused on the middle one, delivering and managed care for most of our existence. And really it's in the target and acquisition and engaging and retaining engagement and retaining that we're really playing catch up. And so CRMs really are these tools, and I think that in addition to the technical tools, it's in all of our best interest to learn the state of the art from other organizations. And what organizations do is they place a great deal of importance on bringing new people into the organization, on maintaining the connection with the organization, doing what it takes to give people a really positive experience so they want to keep coming back. Hospitals haven't thought about that as much, but we're in a new era of coordination and competition, and it becomes important for all healthcare organizations to do this. We're even seeing healthcare organizations in the payer space and the pharma and life sciences space start to take on some of this responsibility for their patients. And what's cool is that they're all using very similar tools because they realize that any chance to touch or connect with a patient is a chance to learn something about them and deliver an improved experience on them. And so to re-show a slide that Peter showed earlier and explain it a little bit in the context of what an enterprise CRM would look like, what you really see on the bottom here are a combination of data sources and people who would engage the data and the applications. And so it's impossible to have a comprehensive CRM without the combination of claims data and clinical data, without the analytics that puts it, that makes it useful, and without the kind of cases, care management processes that are in place. It's also important to note that all people need access here. So the patients, providers, other kinds of partners that might be involved in an organization can all sort of connect in. And once they connect in, then what you see on the top half of the slide, really in the semicircle rainbow, are the combination of things that people can do with it. And what's interesting is to note that, and you sort of see this alluded to in all the different lines that are drawn, is that information or engagement on one side frequently appeals or pops up on another side. Here's an example. When you first market to someone and you reach out to them and you find out where they live and the kinds of services they may tend to use on the patient marketing side, that probably becomes important ultimately for compliance or for making clinical operations more efficient. You wouldn't want someone having to drive all the way across town, for example, and you wouldn't appeal to them to use a pediatric service if they didn't have little children. And so what we find is that the strongest organizations, the most forward-looking organizations, the ones that are best set up strategically to be successful in this time, are the ones that record the information at every contact point and make it available through analytics to all the other pieces. We find this especially in things like donor management. We find this in those organizations that are using Salesforce and Cerner in combination for population health, where they realize that every touch point is an opportunity to connect with people. And so really to sum it up, I think that the two main points that I want to hit home with are the importance of journeys, the importance of mapping out every one of those locations and opportunities to build a stronger connection with a patient. And then also the comprehensiveness of a unified platform, the reason why you might want to be able to connect data across all points, the reason why you might want a longitudinal data source to be a repository for all the information, but also why you need a CRM to be able to access all those data points so that they can be leveraged for improving the results. So with that, I'm going to stop there, and I think we're going to go back to Peter, who'll take us to the end.
Yep, thank you, Josh. So we've had some great questions come through, and I believe keep them coming here. We have a few minutes for Q&A. So, moderator, if you would start to take us through some of those, or I can read some off.
Yeah, absolutely. I can hop in here, Peter. So, first question for you both is an audience member is wondering how will the medium and long-term changes brought by COVID-19 relate to a health CRM platform?
Okay, well, yeah, I can take a stab at that, and then Josh, hop on with more. I think COVID did really increase, like we talked about virtual health, right? It really sort of made it very accelerated and made it obvious some needs around when it's risky or you're unable to see people face to face, you need an alternate way to do that. I think it really also drove home, the importance and relevance of the contact center. I think for a lot of organizations, their contact centers were just swamped with volume they had never seen before, right? Related to cancellations, related to, hey, I have a cough. Do I have it? How do I get tested? And then sort of maintaining that, it created a kind of a crisis to really drive home the value of investing in and maintaining that persistent engagement with our patients, right? I think there's a lot of, less so than there used to be, but still some of that, if we build it, they will come, and when the patients are sick, they will come to see us. That mentality has changed, but with something like COVID, you really realize that you need the ability to have those conversations, to engage with your patients, as well as the permission, right? We all get a gajillion emails and spam calls, and even now the spam SMS messages. So having the permission and the relationship with your patients to send them updates about COVID stats in your community or how to get tested. We had some of our clients do just regular, to every patient, here's the update from our CEO around what's going on, what to expect. Here's how we're working through it together. So I think those would be some things that I don't know that there are any, brand new concepts coming out of this that had never been thought about, but it really surfaced the need and the importance of some of the things we had been focused on.
Absolutely. And just a reminder to audience members, please go ahead and submit any questions that you have in the Q&A box that you see on your screen. We have a lot of great questions coming in. Another audience member is curious. You mentioned a number of intriguing use cases, and they're wondering, if you were working at a hospital system, where would you focus first?
I'll answer that one. Generally, we see digital transformation towards an enterprise CRM is a pretty big task, and it takes not only the technology, but it also takes having a business model that supports it, which we have, but it's changing, and also cultures or business structure in the organization that can support it. And those aren't things that healthcare has had in abundance. And so the transition and the transformation process needs to be pretty sensitive to the current resources and abilities of people, just so that it's as successful as possible. And so where we see a lot of organizations starting are really in departments or projects that they have existing already. So they start with call center, with CRM, this CRM side. They start with call center, they start with marketing, and they start with the kinds of sort of things that are already in place, but with a mind to building an infrastructure that's not just going to solve a point problem or a short-term set of sort of tactics that they want to do, but really they're going to help build an infrastructure that can work as an enterprise CRM. The third sort of course, the third use case that people think of all the time is population health, because that's one of the areas that requires not only the call center or communication center, but also marketing in connection with the EMR, which is one of the reasons why we made the partnership with Cerner.
Yeah, and Josh, just to elaborate on that, really, pick something that you can get your arms around to go and get started and get a win, but always, like you mentioned, design it with the end state in mind. We've had a couple of clients who, they had a budget and an end-to-end vision for enterprise-wide CRM, but they still, I think they took the right approach in, okay, we're starting, phase one is these 2 contact centers. Phase 2 is corporate marketing. Phase 3 is care management. So, sort of leveraging a platform and building that common data profile across the organization, but really focusing on things that you can get live, within months, and start proving value. And you're constantly adjusting this, right? The nature of your relationships and your business is always shifting.
Absolutely. Thank you both for your insight there. It's really helpful for understanding. Another audience member is curious about, CRS systems. A comprehensive CRS system, they said, seems valuable, but also a big task. And so they're wondering, how should we go about getting started, and what do non-healthcare companies do to be successful with CRM?
So I think that's been one of the exciting things for me in this role, and I'm sure, I think, Josh, you spent most of your career in healthcare, but working with Salesforce, the platform and the chassis that we're working on with Salesforce is pretty much the same, whether it's financial services, retail, hospitality. So, it's kind of fun taking the functionality that's used to sell you the extended warranty on your laptop when you call in for a service ticket. We're using that to help people in a contact center close gaps in care. So that's really, to me, one of the fun things working with Salesforce, is just seeing how these technologies and platforms can be, with the healthcare mindset, flipped to do things that are good for the patient, good for the providers, and then good for the organization. So Josh, I'll hand it over to you.
Yeah, I think it's a really good question. When I started my career, I was really focused on the technology, and I thought the answer was really technology. And what I've learned is that it's the opposite. That the more sort of structure and the more thought that goes into place before the technology, the more likely the technology is to succeed and really take hold and have the influence that people want. And so what we see outside of to Peter's point, there is a fantastic point about what happens outside of healthcare is, and I've learned, as you said, I learned a lot being at Salesforce from that. What we see is it starts with a premium placed on every moment connected to the patient. All the things that CRM does, it's important to really value those things. So if you can imagine a clothing company, a retailer, a retailer would be shocked and aghast if someone walked into the store and wasn't approached by a salesperson for a few minutes. Remember, this is sort of old days. These are analogies and images from the old days. But they would be aghast if someone didn't show up and start talking to and engaging one of those customers, or if someone wanted to return something and the return process was unpleasant, or any of these different moments that they realize is where the success or failure of the business or the enterprise is determined. Healthcare is just now waking up to that. And it's not only for the business value, but it's also for the health value. When we see such disparities in healthcare, in access, in outcomes, and so on, I think the only conclusion we can draw is that the relationship between organizations and patients could be improved to address some of those gaps. And so what we see is start to believe that it's important. Start to feel like every one of these feelings that your patients have are important, and then realize the power of CRM to address it. And then the second, I think, dimension, or the second phase of something like that really comes when people start to put some of these practices into place, where they start to build their journeys, they start to analyze their journeys, and they start to really improve them. There's one healthcare system that I was talking to, and they talk about the moments of sort of patient abrasion. And they look at every single phone call that someone makes, every single question they have about a schedule or a procedure or about an outcome, and they see it as an opportunity to educate and to build that closer connection. And so they're putting metrics and they're putting analytics attached to every one of those moments so they can improve them. And I think it's that process of building a learning system, building a self-improving system that I think is the most powerful tool to be successful at CRM.
Those are some really great examples. Thank you both for your input there. Had a lot of great questions come in. One person is wondering, to the point on speed to value, what is the implementation time frame for Salesforce and CRM analytics that you discussed today?
Yeah, Josh, I know you all had some really neat rapid stand-up projects related to the COVID package and contact center. Maybe we can start with that and then talk about kind of the beyond that, some of the other projects we're seeing.
Yeah, it's hard to answer in general because there's a broad range, and it really depends on the complexity of people's projects and how well they're outfitted. But Peter makes a really good point. We are known and we take a lot of pride in our agility. And so both from the standpoint of refashioning Health Cloud into our work.com return to work contact tracing app that's now being used by, hundreds of, or I should say, almost 40 states, and it covers hundreds of millions of people already, to actually implementing some of those systems. And some of them we really implemented in days. I think there are some states that did the contact tracing and really went live in just a matter of days, private companies that have done the same thing. We don't see that same kind of speed when it comes to a contact center, for example, because of all the back-end systems and so on, but we do see much expedited implementations, usually on the order of weeks and not months, depending on the scope.
Yep, and I'll just add that that's pretty consistent with what we're seeing, and we've got some great system integrator partners as well who do a lot of the actual implementation work along with Cerner and Salesforce. So yeah, sort of in that it does vary quite a bit, but we are seeing iterations in the sort of the 8 to 12 week range. So for those of you who have done EMR implementations, typically much quicker than that.
Got it. Thank you both. And sorry, Peter, for interrupting you there. The next question is about physician buy-in. Someone is wondering, they're just starting their journey toward being patient-centric and developing a virtual platform. And so they're wondering if either of you have advice on how to get physician buy-in.
I'll give it a shot.
I will defer to the
chime in. Again, I'll just talk about my own education. I think there was a time when I thought that appealing to physicians' sort of altruism and eagerness to do a better job for patients was the path, and I don't think that's the case. And it's not because of the well-meaning, well-intentioned physicians out there. It's because just the so much pressure, so little time, so many things to do, so many other competing priorities. And so what I found is that the ways that people are most amenable to changing or adopting new things or seeing value is if they benefit from either if they get time back, if they can increase revenue, or if somehow they become, if they can find some way to, improve their, I'll say power, not sort of like political power, but their knowledge, their comprehension of the patients that they're going under, that they're taking care of, or their ability to engage folks. And so CRM, in its ability to let people relate to more people, take care of more people, and make sure that they address the people's sort of feelings around all this, are sometimes important points that are compelling to docs.
Yep, and I'll agree with that. And we are seeing it, especially with more and more value-based contracts. There is that competitive nature of physicians as well to kind of compare scorecards, and then using like the gaps in care example Dr. Newman covered, right? How I can only see one patient at a time, only so many appointments in a day, but how can I use CRM technologies to go outreach to many patients when they're not in the office, is a key part of it as well. And I guess one other thing that we are working on is how can we, again, kind of reverse synthesize. I talked about the clinical data to the engagement data, but how can we start to synthesize the engagement data? And, at least in Cerner systems now, we're working on putting some of the engagement data face up within the EMR. So you hear, some physicians complain about, marketing sent, the breast cancer awareness thing out again, and now, I'm caught off guard. My patients are talking about it, and I have no idea. I've never seen the thing. So how can we pull back some of the Salesforce data into the clinical workflow to give those doctors and nurses a heads up on, hey, your patient was on these campaigns. You can, see if they read the email, see what the email said, so that they can seem informed on a moment's notice.
Yeah, it was a really great question, and thank you both for your feedback there. The next question is sort of a scenario. An audience member is wondering, they typically see digital transformation begin with the EMR implementation, followed by contact centers and patient access services. So they're wondering if you both see the same.
I'll start that one. I think, the key word there is digital transformation. A key part of this is having those digital systems to power the profile or just even to do the scheduling. It's hard to interact with paper, but, that doesn't have to be a prerequisite, but we typically see that, once things are digital, once that clinical data is digital, the scheduling data is digital, you can do some really neat things by adding CRM to the mix, but it's not necessarily a 100% sequential order type of thing.
Yeah, and just to add something that's obvious to everyone, I think, is that the original digital transformation was the EMR. Remember, we were on paper not that long ago, and it's a radical change to go from paper in a hospital or healthcare system to an EMR. And I think we're really grateful to the EMRs out there for making that happen. I think when we think about digital transformation at Salesforce, we're thinking about the next sort of phase, which was taking sort of, what I think was a really important innovation and making sure that it was reaching people on their mobile devices, reaching people at home. It was able to connect the many to the many, so all the different providers of healthcare to all the different patients out there, and that has the flexibility to adapt and change over time. So that's when we talk about putting the CRM on top. Frankly, I haven't even heard of an organization that would go with CRM before they had some kind of clinical system to manage things. And so I think to the questioner, that sequence is something that we see all the time.
And I'll just add on to that. We are seeing the engagement and the CRM pieces actually drive EMR changes and optimizations as well. So even thinking about appointment data, a lot of our clients have built up their EMR configurations over decades now. We had one client with 85 appointment statuses, and so we walked through them with their dashboard, and you guys are going to have to tell us which of these are cancellations because we can't even tell. So, as you get into things like virtual visits or patient self-scheduling, you kind of need to take a look at how your EMR is configured and structured to where you probably won't get much adoption of self-scheduling if you have a drop-down with 85 appointment statuses or 800 appointment types, right? You need to simplify it when it is really designed around that consumer that we talked about earlier.
Super useful advice from both of you, and that brings us to the end of our webinar today. So I want to extend a thank you to the audience members who submitted some just excellent questions, and also for Peter and Joshua for a fantastic presentation. Also extend thanks to Cerner and Salesforce for sponsoring today's webinar. So I hope you all enjoy the rest of your day, and we do look forward to having you join us for future webinars.